Hi everyone, this is Kate Warnock coming back to you live from MediFuture, Day 2. I'm so pleased to have with us in the GuideWell Insights Lounge a very distinguished speaker, Dr. Marty Makary. Dr. Makary, welcome.
Good to be with you, Kate.
We're so happy to have you here. Dr. Makary is the author of the book Unaccountable, as well as the director of surgery for Johns Hopkins. Dr. Makary, let's get right into the questions for you. I'm wondering, do you think that today's medical residents are more willing to question their attending physician on their rounds because of Unaccountable?
You know, I think the conversation started by Unaccountable has been a really healthy conversation for a couple reasons. One, we were kind of raised in a medical culture where if you see something that doesn't look right, you kind of keep your mouth shut and maybe talk to your immediate superior, but you never really escalate anything. And now for the first time, we're hearing stories of a nurse or a physician who was fired for speaking up, and it turns out that an internal investigation found that all their claims were substantiated.
Right.
And there's this sense of, why are we in the field? Are we here to help patients, or are we in this field to get the job done? And I think that overwhelmingly, folks feel like, you know, I want to be a part of a system that I'm proud of. And a system that harms 1 in 4 hospitalized patients, and a system where medical mistakes are the number 3 cause of death is not really the system I want to be a part of. So there's this incredible enthusiasm right now to take the ideas in Unaccountable, which were controversial when I put the pen to the paper, but now they're accepted and they're out there and they're highly esteemed as general virtues of American society: transparency, honest, open communication, that kind of thing.
So I guess then, do you think that in the 2 years since the book has been written, you know, you had positioned that really no one was in charge of medical care in the United States. Do you think that that has changed in these last 2 years?
I do. I think there's an intense sense of personal responsibility by hospital board members, by hospital administrators, to say, hey, look, if this happened, I want to know more about it, and I want to figure out how can we prevent this from happening again. I've seen this with our own administration at Johns Hopkins, where over the last 15 years, there's been this intense escalation to get to the bottom of adverse events and to fix problems so they don't happen again, like the Josie King preventable death, the death of a child. When that happened, there was an intense interest in getting it right. And we haven't seen that sort of reaction in American healthcare in previous decades. It's a new day. Ask any hospital CEO, what is your number 1 priority? And they will tell you patient safety.
Well, I think that's good for everyone. You know, I think that your checklist that you created and have since become widely adopted has really changed, you know, how medicine is practiced. Not every consumer, though, is comfortable with talking to their doctor and asking them, you know, how safe should I be with you? How is it that the average consumer can make sure that their physician has their safety first in mind?
Well, I think that, first of all, the checklist idea, I think, struck on a thirst for common sense things in healthcare, right? Healthcare is so polarized. Our country is so polarized in so many ways. Healthcare reform, so many other aspects of healthcare. Here's something we all agree on. We should be able to have a civil work environment and a civil conversation. And Dr. Pronovost came up with the idea of the checklist in the ICU. He said, hey, Marty, you should come up with one for the operating rooms. And it's subsequently been popularized and really gotten out there in the WHO. And several people have really been great champions. It's been refreshing to see people connect with a common sense idea. But really the idea is, how can we, you know, most important item on the checklist, introducing who we are and what we're doing before we do something, before we do an operation. It's restoring some dignity to the nursing profession. It's creating a sense of value to each member of the team. It's empowering folks to say, hey, if you don't see something that looks right, I want to know about it as the head surgeon for this room. Please let me know. And opening that dialogue early, turns out, is a terrific safety net for preventable adverse events.
That's terrific. So, you know, I know that you're also quite passionate about, you had already mentioned, transparency and quality. Who should be driving those quality standards? Is it the government's existing set of standards, or, you know, who is in the best position to really say this is how we measure and define what quality means across the healthcare system?
Well, Kate, I still operate 3 to 4 days a week, busy, complex, long pancreatic operations, islet transplant operations, and I think something that's given me as a perspective that we've got to keep the physicians in charge of healthcare. We need the doctors' groups to endorse the metrics of quality and say this is a logical and reasonable way to measure quality, and this form of risk adjustment is a fair way to risk adjust, because if you put a level playing field in front of doctors, they will outperform every time.
Right.
But when the metrics are crude and raw and imperfect, doctors are right in being concerned that we're going to unfairly punish those that discriminate against the tough cases and reward those that discriminate and punish those that take on those high-risk cases.
Right, right. Well, I think that's a great connection into my next question for you. You had recently commented on a story that ran in the Washington Post that was talking about a marketplace for operating procedures. You know, I think that's a whole new day for the type of medicine that might be explored. But I wonder, in your position, what is it that payers and providers can do to collaborate and offer more affordable care so that something that is as unregulated as a marketplace for operating procedures might be diminished?
You know, there's this intense public demand right now for price transparency, and soon to follow is going to be a demand for quality transparency to be coupled with that price transparency. That is, folks want to know that they're going to be able to deliver a baby and the cost is going to be $8,000 including everything.
Right.
Parts and labor for 50 years or whatever you want to think of it as a warranty.
Right.
And I encourage hospitals and CEOs to say, hey, look, maybe you want to set a fixed price for your gallbladder operations, assuming a patient meets reasonable criteria and they're not extremely sick.
Right.
There's a demand for that out there. People are paying out of their own pocket now with these high deductibles, and they want to say, look, if $8,000 covers everything related to that operation, I'm willing to pay for it. And they can factor in the risk and build in whatever formulas they want to give themselves the profit margin in the end. But I tell hospitals, set a fixed price for an operation with predictable risk and let the patients just start rolling in. And we're seeing that internationally. We're seeing that now. If I told you, hey, you need to have a stomach cancer surgery, why don't you go overseas? You'd say, what, are you crazy? But what if I said, hey, you're going to have a dental extraction? How about this hospital in Costa Rica on the beach by the Four Seasons? By the way, it's a U.S. top quality hospital affiliate, and the doctors are from the U.S. All of a sudden, hey, it's a lot more appealing if you're going to save $10,000.
Right, absolutely. Well, my final question for you, Dr. Makary, is you're quite active on Twitter. It's Dr. Marty, MD, and I'm wondering, what do you perceive as the value of that Twitter feed and you being able to converse directly with patients, consumers, other thought leaders? Tell us about your use of social media.
Well, for a lot of folks, that is an important way to communicate. For me, I'm in the operating room most of the days. I'm not on social media, but when I get out, it's nice to hear the comments, the feedback from the book, the experiences that people have. One of the greatest privileges of being an author is when you write down your own experiences, you get a flood of other folks sharing their experiences, and you learn so much, and you get to travel and visit hospitals and hear the stories of early experiments with safety that are incredible successes and homegrown ideas that doctors have come up with. And that's the neat thing about social media, is it creates this dialogue, and it allows patients to communicate with me directly and say, hey, I heard this can be done. Do you know of an orthopedic surgeon in my area? And it's just a fun way to communicate.
So you don't necessarily see that as a draw against your time. I mean, heaven knows you don't have a lot of free time, but this is obviously something that you're willing to engage in because you get something back from it too.
Yeah, I don't always reply within 30 seconds like some folks, but with enough of the 7-day turnaround allowance, it's a great way to
I saw a tweet from you. You were at a conference, I think, outside of Savannah, and you tweeted that you love the Savannah airport. I was just dying to know, what is it that made you love the Savannah airport?
It was so comfortable, but the funny thing about it was that the airport retweeted my tweet.
Of course they did.
So it's like the kind of fun dialogue, you know, and sometimes you wonder, what are we having all this chatter? But there's a new movement in America to create a shared society where we share zip cars and all sorts of things. And I think the social media revolution is for the folks that like that kind of sharing culture.
Well, I think what it does too is, you certainly have a lot of patients that are interested in who you are as a person. as well as other professionals, and this really lets them get to know you outside of the operating room or outside of a keynote address. So I think the value would be tremendous in continuing with that, and I'm so glad that you do. Well, Dr. Makary, we actually have a video that was produced when you wrote your book, Unaccountable, that we would like to go ahead and share with our viewers now. But I want to thank you first so much for your time with us today, and hope that you enjoy the rest of your time here at MediFuture.
Thank you, Kate. It's
All
great
right.
to be here.
Thank you.
Thanks so much.